Good afternoon. Thank you for joining Family Caregiver Alliance for Paying for Elder Care. Discover all your financial assistance options. My name is Calvin Hu, and I'm the Education Coordinator at FCA and your host. For nearly 40 years, Family Caregiver Alliance has been working through the Bay Area and across the nation to improve the well-being of family caregivers that are providing long-term care. We offer caregiver support through classes, workshops, publications, retreats, support services, research, and advocacy. You can visit us at www.caregiver.org. For the duration of the presentation, your phones will be muted. If you have any questions, you can ask them by going to the GoToWebinar question box on your screen. We'll answer as many questions as we can at the end of the presentation. At the completion of the webinar, you'll be asked to give feedback. We use this for shaping future education programs, so I'd like to thank you in advance for filling those out. We always love to hear from you. Today I'd like to introduce Michael Guerrero, who is our guest for this month's webinar. Michael is Director of Client Benefits at the American Elder Care Research Organization, where he assists families and caregivers with understanding what benefit programs they're eligible for and how to afford long-term care. The American Elder Care Research Organization maintains payingforseniorcare.com, which is a free information source on hundreds of elder care benefits programs. Now that you know a little bit more about our guest, I'd like to turn things over to Michael.
Thank you, Calvin. My name is Michael Guerrero, as Calvin said, and I'm with the American Elder Care Research Organization. And I'll just say before I begin that this is one of two hats that I wear. I also am working with the American Elder Care Research Organization under our brand Elder Care Resource Planning to help families directly in one-on-one consultations and advisory support to make the most out of their benefits. But today we'll be speaking from the depth of research that the American Elder Care Research Organization has done on the wide range of available benefits. And so you know a little bit more about our organization. Before I begin, I'll just touch on our mission. We are a family business, but we consider ourselves a mission-driven organization as well. And in simple terms, our mission is to provide tools, information, creative ideas to help families and caregivers discover the means for paying for care for elderly loved ones. As you can see, we picture it kind of like a puzzle, and there's a lot of pieces that can be put together to help with the overall financial picture for long-term care for our elderly loved ones. We work across the country, and so in all 50 states plus DC. And we are a San Francisco-born organization. So before we get into actually talking about the programs available, I'm going to spend a moment to talk about needs. And I've put together a couple of ways to think about needs, especially unmet needs and met needs of our seniors, of our elderly loved ones. The first one, as you can see, is a scenario where the elder's needs are greater than, should be a greater than symbol, the resources and the available benefits available. And in the second scenario, there's all the elder's needs are met, and that's because their resources and benefits available to them are greater than their needs. This only works, of course, this formula only works if one is aware of all of the available benefits and works to make sure that they make the most out of those available benefits. So what we're trying to do, again, is really provide the information to make sure everyone is getting at and accessing their benefits. And before we talk about benefits per se, I want to spend a moment just to think about care in general. And what is care? How much care is often a very important question in terms of being able to access benefits, whether they're public, private, federal, or state. There's always this question about how much care does the individual need, and have they reached that level where the program determines that they will support or help out in some way. Often what we're talking about is activities of daily living, and many programs use the guideline 2 or more activities of daily living. These are defined by the federal government, and we're specifically speaking about 5 activities of daily living. In addition, those 5 are the toileting, transferring, dressing, bathing, and eating. In addition to those 5, we often think about the instrumental activities, cooking or medication management or shopping, those things that are very important but not absolutely essential to getting through your day with or without assistance. And of course, when we think about care, we often think about the level or type of care that's necessary for older Americans with dementia and Alzheimer's. And so that is a special type of companion care or supervision we're talking about, and often requires a lot of hours but not a lot of work necessarily during those hours. Supervision. And then, does the individual have the need for skilled nursing or professional medical assistance? Is it able to be provided at home or in another location? So the good news here is, from our experience in researching so many different programs, there is really a wealth of programs that help out almost all the different levels of care that we were just talking about. The bad news is that they're really hard to find sometimes, and even harder to understand when we're talking about different public benefits. Not so well published, or very hard to access a human being or a service social worker that works with the social services in your area to really understand what those eligibility requirements are. So that's why we're doing this today. We're really trying to paint out a picture for everybody listening about all the range of programs available. And so what I'll do is I'll walk through the programs at the different levels that we like to think about them. 1 at the local level, 2nd at the state level, and 3rd at the national level. And then finally we'll touch on just briefly some of the private options that are available, also to kind of bridge the gap for families. So at the local level, we have area agencies on aging. These are provided almost or all throughout all the areas of the country, and are provided by the federal agency on aging. And what they do, there's support from them. They provide, first and foremost, a resource, an information resource for families living within their service area, for them to learn about the available programs, learn about eligibility requirements, and always speak to or go into and have a personal one-on-one conversation with one of their social workers or help desk individuals. And they provide, really, in addition to information, often they also have services, and these are provided through federal grants. They're subsidized or no-cost services, and they're limited, but they're also very important. So we start with home care, companion care, sometimes adult day care. Transportation benefits are often included, sometimes they're volunteer run. And of course, a very helpful but very small task of reminding somebody to take their medications on time, or doing calls to check in on isolated seniors in their homes. These are all the wealth of possible programs in each one of the area agencies on aging throughout the country. There's over 500 of them. Provide a variety of these services. None are exactly the same, but many provide these basic levels of services. For instance, in Gwinnett County, Georgia, they provide a homemaking support service. The idea here is really to help seniors make sure that they're supported throughout while they're living at home, especially with those instrumental activities of daily living. You know, the light housework and laundry and some other services that might be needed to enable them to stay in place in their home, in their community, with their friends and family nearby. The key here is that there's a sliding scale often. In this case, there is a specific sliding scale depending on income, and there's a limited number of hours. But this is a great program for those seniors who are lower income and don't have many resources in the area. This is an example at county level. At the state level, and the area agencies on aging will also be a good guide for these programs as well. There's often specific state programs. Some consider medication and the cost of prescriptions that are out of pocket for seniors, and we all know how the cost of medications for seniors can be very high. They also provide more sophisticated and more time for home and community sports for lower income residents. So these are benefits that are often funded by the state, and they're outside of Medicaid. So the important thing here, many people are aware of Medicaid, and yet their understanding is they're not yet eligible, or they're not eligible. And so the good thing about these programs is many are designed to be available to those who do not qualify for Medicaid. An example here is the Indiana Choice program. CHOICE is an acronym. It's Community Home Options to Institutional Care for Elderly and Disabled Individuals. They provide an array of services to help the senior stay out of a nursing home. And we all know there's a lot of benefits, mental as well as physical, to being able to reside within their community in their home, and it really helps a lot of elderly individuals stay mentally sound and as well as physically sound, as long as they get that extra help to make sure that they're safe and their needs are met at home. And this, like I said, is a state program that's available to those who are not yet eligible for Medicaid. So Medicaid, we've been talking a lot about this, and many people who are listening today might have Medicaid on their mind. How does Medicaid work? What is Medicaid? Many people confuse Medicaid for Medicare. Of course, Medicaid is a similar federal program. It provides for health care, but it also provides for long-term care solutions and support for individuals. So it often picks up where Medicare does not pay for a nursing home or for other, like we said, home and community-based services. Some services from Medicaid are considered an entitlement. That means as soon as you qualify, or your elderly loved one qualifies for this service, they are eligible to be reimbursed or fully covered for their costs. Especially true for an elderly individual who requires nursing home care, cannot safely live at home, and does not have any money to pay for it. This is a scenario where Medicaid is there for them. In addition, there's many programs that, because many elders want to stay out of nursing home, and these are known as waivers, or sometimes known as home and community-based services. Although these are wonderful alternatives to nursing home, and they really help to support the senior at home, many are not fully funded, and so there is limited availability for these services. So you could qualify, but then you would have to wait to get the services. So two additional things to keep in mind. Your state might have a state plan for personal care assistance. This is a way in which they provide entitlement-based services to the individual for personal care in their home or in an independent living facility. And another newer program that just came online in the last year and is just now being rolled out in several states is the Community First Choice programs. And these are, again, home and community-based services, but are entitlements, and as long as you qualify, they'll be there for you. So they're fully funded in those states where these exist. Not yet fully rolled out in all 50 states. So many people have questions about Medicaid eligibility, and they understand that you need to be really poor in order to qualify for Medicaid. And generally, I'm going to very much simplify the rules because each state has their own slightly different version of these rules, and that means that they're not all the same. So this is a simplification. One, the individual who is qualified or who is applying for Medicaid must be ready or needing that level of care associated with a nursing home. Generally, that means we're talking about the activities of daily living. They need assistance with at least 2 or more of them. Could be partial assistance. In addition to that, there's the financial criteria. Very simply, in general, an individual must have less than $2,000 in what we call non-exempt assets. We'll get to that in a minute. And then also less than $2,200 in gross monthly income. So you get an idea here. This is going to be very restrictive for the individual. However, it does not mean that you have to be completely broke. And there's a lot of exceptions. And I'm going to highlight 4 of the most important exceptions here today, so you can remember that planning and preparation can be done in advance of needing Medicaid. That'll help you, 1, make sure your funeral costs are paid for if you're the elders and thinking about Medicaid. Also, remember the home itself, where you reside, and the vehicle you use is going to be exempt. These are not assets that need to be spent on your care before qualifying for Medicaid. For couples, there is a whole set of rules that allow the healthier spouse to protect a certain amount of income and savings, especially retirement savings or other savings that they've had put aside especially for their later life care. And then fourthly, for those individuals in certain states, they might require using an income trust. This is a scenario where your income is too high, and then you can lower it by using an income trust. In those states where you don't need an income trust, you need instead to show that your medical costs in that for you in particular are in excess of or very high relative to your income. So that was a crash course in Medicaid. And everyone knows who's spent any time researching Medicaid, it's a lot more complex than that. And we'll probably have some questions in the Q&A. But I wanted to highlight a few other programs so that we keep our survey going here of different federal programs that may be an alternative to Medicaid or provide other supports for an elderly loved one. One is a little-known program known as Extra Help. I always have to laugh when I hear the name of that program because it's kind of cute. It's called Extra Help for prescription drugs, but many people just refer to it as Extra Help. And you just need some extra help. Well, that's true. And this program specifically helps with the deductibles and the donut hole associated with federal prescription drug insurance. And so for seniors who are low income and have assets generally below $7,000, then they're eligible for this program. Another one that you should make note of, especially if your elderly loved one has very low income, living maybe as a single individual, and in this case as well, they might be eligible for their Medicare premiums to be paid. This might not sound like a lot, but if you're making $1,000 a month and you're paying $100 a month for your Medicare premiums, you've just increased that individual's income by 10% that month. So this is always good to keep in mind, and I'm always surprised by how many people don't know about the Medicare Savings programs available nationally. And then I want to highlight, and I've separated out the VA benefits from VA healthcare. Many people think that VA is just for healthcare and they're unaware of the benefits side. Benefits work separately from VA healthcare, and they offer things like a senior veterans pension for veterans who have served during a period of war, such as World War II or Korean conflict or Vietnam. They might be eligible for income support or, conversely, a pension to help them with their care costs later in life. VA healthcare, of course, provides for those who qualify, certain veterans who qualify, nursing home care, and sometimes home and community-based support as well, depending on the VA facility in your area and whether they cover that services. I said I wanted to touch on some of the private options as well. And for the private options, a lot of people might have heard about reverse mortgages, and they don't know, they've heard some bad things about it. I think what's important to remember is that these are products that are available to help, and in some cases they actually might be helpful, but they are there's often sales teams and individuals associated with some of these private products that tend to push these products into areas and onto people who they're not necessarily the most appropriate products for them. So keep that in mind. We always recommend that if you are thinking about a reverse mortgage, you should be thinking about staying in the home for quite a long period of time to really bring out the value of that product and be able to live without a mortgage and with some income, extra income coming in the door. Up to 5 years is at least an ideal. Less than that might work, but if you can't imagine the elderly individual staying in the home for more than 2 years, then a reverse mortgage probably isn't the right product. There's also home equity loans. There's a product called Elder Care Bridge loans. These are loans that allow family members, sometimes a series of adult children, to all co-sign a product so that the interest rates on this product are reasonable. We're within the rate for, say, an auto loan or something like that, a private auto loan. And in the case where you use this, you really want to have an ability to pay off the loan in the future date, usually from something like a forthcoming benefit payment. So you're only borrowing in the short term and you incur very little interest. And it's a great alternative to credit cards in that case. Many people have insurance policies, and sometimes Medicaid has restrictions on the use or the allowance of the individual to carry life insurance when they enroll in Medicaid. And so a conversion of that product to either cash or a settlement of some sort might be appropriate, but not all of them are for Medicaid compliance. So it's just some things to keep in mind when it comes to the private options for paying for care. You might be saying, gosh, there's a lot of things to keep in mind. Everything from local programs to state programs to federal programs, and then these private options. What if we have a lot of options but we don't know which ones are the best ones? Well, there might be assistance. Well, I know there's assistance out there for you, actually. First of all, you should think about the area agencies on aging. Ask them about their advice. They're often staffed with really well-trained individuals who have years of experience, and they can give you some really good guidance on how to make the most out of the available programs. Another option, this is from our organization, payingforseniorcare.com, the website that we publish. We've built what we call Elder Care Financial Assistance Locator. And the Elder Care Financial Assistance Locator is a tool. It's basically a questionnaire. Allows you to auto-select or find the most specific programs to your elderly loved one's scenario. So it'll be based on your zip code, so you'll find specific local programs, but you'll also find programs that they're already financially eligible for. And it's meant to be very comprehensive. Another way of thinking about this might be to work with a specific benefit advisor. These are individuals who may or may not be attorneys, but they are really very familiar with the eligibility rules for the type of benefits that you need. And they can help guide you through that process, whether it's making an application or making sure to prepare the individual's finances prior to applying. These are individuals who might be able to help you really make the most out of those benefits available. Another important facet of professional assistance would be elder law attorneys. These are individuals that typically work in estates and trusts, and trusts are something that are typically used to help with the costs of later life, putting aside money for certain specific purposes and doing so in advance of the need for benefits. So that's often done in well in advance, but elder law attorneys can also help with benefits applications or with particularly tricky appeals or denial situations. Of course, the Veterans Administration has a wonderful network of what they call Veterans Service Officers. These are individuals who are often county or nonprofit employees who are specially trained to work on behalf of veterans throughout the country. And they can help with your benefit applications for various benefits, including disability compensation and special monthly compensation for elderly veterans who are disabled from service and need an extra hand or a little bit extra income, as well as the senior veterans pensions that I spoke of earlier that can really help out with the cost of care for veterans or assisted living. This month, it was almost 30 days ago now. I almost forgot what month we're in. We're still in September. So this month we released, the American Elder Care Research Organization released on our website a new tool called the Paid Caregiver Program Locator tool. And this is an important way in which, again, like the other locator, the Elder Care Financial Assistance Locator, this one will ask you a series of questions and will help you identify the most appropriate programs for you as a caregiver, a family caregiver, to be compensated for the work that you've been doing for your elderly loved one or family member. And so there's a number of different programs here. Couple to keep in mind, the VA pension might be a way in which a family caregiver could be paid. Another might be through the Medicaid home and community-based services. These are sometimes called cash and counseling programs, although that name is being used less and less these days, and more just participant-directed programs. And that means that the participant, the Medicaid enrollee, can select who they want to be their caregiver. In this case, they select the family caregiver that they currently have, and then Medicaid pays for that individual to provide the same care that they're doing before Medicaid. In all of these cases with family caregivers getting paid, it's really important to make sure that there's documentation about the type of care and the type of services that are being done, the start and stop dates for those services. And so we always recommend a written agreement. We have templates available on our website for caregivers. If they're looking towards getting paid, even if they're not eligible currently, but may be eligible in the near future, they should start to put down a caregiver agreement so that that work that they've been doing is documented. All right, so I've been highlighting a few of the resources and links that we have throughout this talk on our website, but I wanted to circle back and provide you again a reminder on a couple of those. Once again, American Elder Care Research Organization publishes Paying for Senior Care, so keep that in mind. It's a really good starting place for a lot of different financial questions for senior care, of course. I've highlighted the excellent services that are available locally to you throughout the area, agencies on aging. These are sometimes also called the Disability and Senior Resource Centers, so they can carry many different names. They're sometimes run by local governments, sometimes run by nonprofits, but the idea is that they are all funded by the Administration on Aging to provide this aging level services to you locally in your community. And so be sure to find those resources, those area agencies on aging, and you can use the locator on our website. That is a specific county locator, so just enter the county you live in, we'll find the right one for you. And then the Elder Care Financial Assistance Locator, of course, which is our primary tool to help you identify and discover programs that might be eligible for the elder. And then finally, the Paid Caregiver Program Locator, our newest tool in our series that was just introduced this month. And I should say that the paid program paid caregiver program locator is still in beta, much like my pronunciation of its title, as still in beta. So we welcome your feedback. If you've gone on there and you've been frustrated by it, or you discover something that we're missing, please let us know. And you can send us an email. And here it is. There's the email. You can send me directly an email to the address you see there. It's actually miguel@payingforseniorcare.com. You can reach me on my direct office line, or you can reach us on the general inbox and general voicemail box for our organization. So I think that's all the prepared slides, but I know that with many of these talks, the real meat of the talk comes with the questions that come up from the audience we have. So we made sure to reserve plenty of time for your questions.
Perfect. Well, thanks a lot, Michael. We're very happy to have you here today, and thanks a lot for sharing all that information with us. I know it can seem pretty dense and Byzantine, all these various levels and different programs. So I appreciate that you came to share with us and to talk about kind of the basics and to go from there. We do have some questions. First off, actually, I had a question for you. I was wondering what tips or advice you might have for our listeners to avoid, say, scams or fraud, things like predatory lending, things of that nature.
That's a great question. I'm glad it came up, actually, because we talked about the private options. And while these are important to a comprehensive view of funding elder care, these can be also a pitfall for some families, and like you said, some of them can be fraudulent. When a senior is getting those calls and the senior is elderly, may not be mentally capable of making sound decisions, it's important to make sure that there's somebody screening those calls on their behalf. So whatever it takes to make sure those calls aren't being answered directly by the senior if they're not capable of making the decisions on their own anymore. One of the important things, I think, when we're dealing with firms is we want to make, if we are evaluating a serious proposition, we want to make sure to look at their website, look at their reviews, and if they have a Better Business Bureau registration, look at that information. And often these days we can find from services in your area, we can find many different review sites, from Google to the one I'm forgetting the name of right now, but Yelp, that's right. And so when it comes to these services, don't be shy about looking to third parties and getting other information, and you never have to accept the offer in the first time you talk, whether it's for a loan or other services.
Perfect. Thank you so much. You talked a little bit about reverse mortgages and how there's kind of some guidelines in terms of maybe a 2-year minimum, but ideally maybe more like a 5-year. But I guess if you could talk a little bit more about situations where a reverse mortgage would really make sense for a senior to afford care in their home, and maybe are there any alternatives to a reverse mortgage?
Mm-hmm. Mm-hmm. There is a couple alternatives emerging right now. The trouble with the alternatives is that they're emerging. That means that they're not fully available nationwide, and they're not well vetted in terms of their regulatory oversight. Reverse mortgages, whether you have an opinion of them or not, they are regulated quite closely by the federal government, consumer protection, and so you should be aware of that. So these products are good. The basic idea is that they can provide, if an individual is still paying a mortgage, they can help to eliminate that mortgage, or if the individual just needs extra income, they can provide extra income. And so long as the individual or couple remain in the home, that mortgage or loan will never be due. So it's really a scenario where they're likely to be physically capable of handling the ins and outs of their home for an extended period of time. And it's hard to predict, I know, but the best guess should be for definitely for a median term of about 3 to 5 years. So you can really take advantage of that loan never coming due while the individual is residing in that home. Of course, the loan usually is collected upon the sale of the house, and the sale is forced when the elder is no longer able to reside in the home. Those are things you should keep in mind. These days, there are alternatives, of course, and if the elder is really low income, then it's likely that they should be able to qualify for Medicaid instead of having to use these private products. So a benefits advisor or the area agency on aging should check that out.
Okay, great, thank you. Let's see, we have a question about the Medicare Savings program. So our listener would like to know a little bit more about it in terms of paying the monthly premiums for a senior who's got a low Social Security income and who's also on Medicare.
So go ahead and repeat the question again. So it's low income? Go ahead.
Yeah, sure, of course. So I'll just read the question verbatim. So our listener is asking, can you say more about how one would go about finding Medicare Savings program to help with paying the monthly premium for a senior who has low Social Security income and who is on Medicare?
And who's on Medicare. Okay, got it. So the Medicare Savings programs are all published by the Medicare.gov, so you can always find information there. But let me give you a brief overview of some of the programs. There's actually 4 different programs, but the highest income level for an individual is right around $1,200. So if an individual has about $1,200 coming in income and they have less than $7,800 roughly speaking, in savings altogether, not including a car or the home or any personal property, then they would be eligible for this Medicare Savings Plan. If they have less than either of those figures in income or in assets, then they would definitely be considered for this program. And there may be other benefits, including assistance with Part D premiums. Part D, of course, is the prescription drug medication premiums.
Okay, perfect. Thank you. We have another question about long-term care. So the listener has parents whose care has been very expensive, continues to be expensive, and so for themselves, they're considering purchasing long-term care insurance, a policy for the caregiver, and they want to know a little bit more about the product, maybe some recommendations or some additional information.
Yeah, definitely. That's something I actually was interviewed for recently for a website called ourparents.com or .org, and they wanted to know a similar sort of question, which was, when is long-term care insurance appropriate? And it's really confusing. For most of our parents, if they're say above 70, this program is no longer, this insurance is really not available for an elderly individual. But it is available for individual who is maybe middle-aged or a little older and who is thinking about the cost of care and worried that they may not be able to afford their own care, or their family members. They don't want to be a burden on their family members. The devil is in the details here, for sure. These policies are written with quite a few conditions and riders. These are insurance speak for ways in which their rules can be used to not cover a claim, and this is something you should really carefully analyze whenever considering an insurance product. I always recommend you get a third party or a second opinion on those policies so that you have an extra set of eyes looking at them before purchasing them, because this is a major decision as well. It may not look like very much in terms of monthly premiums, but it's a long-term expense, so it does add up. a lot of these policies, you should keep in mind, have lifetime caps as well as daily or annual caps on benefits. So they probably won't be the only silver bullet solution for you. The way these policies are written right now is that they're at best a partial payment for the long-term care costs. And if that still works for you, then you should look at those policies carefully and have somebody else look them over before considering them if you're in the age group where it's still beneficial for you.
Okay, great, thank you. We have a question actually about the VA benefit program. So this listener wants to know, so they are part of this VA benefit for pension, and they want to know a little bit more about the unreimbursed medical expenses. They have a father who has recently purchased a hearing aid out of pocket and had, I guess, some dental surgery, and this was a rather expensive hearing aid at close to $5,000. They wanted to know if he could claim these as reimbursed medical expenses on his VA application.
Okay, yeah. Now we're getting into the details here. This is great. A lot of people, and this is true from a lot of the clients and other elders that I speak with on a daily basis, is they've done a lot of research on their own on the internet, and they're not sure what to make out of it all. Some of it's contradictory with other information they've read. So this is one of the most confusing areas in the VA pension application, and is the allowance for the VA for the applicant to reduce their income and therefore increase their pension benefit through subtracting out any of the medical expenses that they haven't otherwise had reimbursed through their health insurance. First and foremost, everyone has some of these expenses because we all pay for Medicare or other health insurance costs. And so their premiums are what we would call unreimbursed medical expenses for the VA's purposes. But in addition to that, you're out of pocket on your drugs or other things. Now, the caller's question is about the hearing aid and dental surgery specifically. And these are, technically speaking, unreimbursed medical expenses for a veteran. However, when a veteran makes an application for their pension for the first time, the VA isn't concerned about expenses that occurred in the past. What they're concerned about is trying to estimate the future expenses, medical expenses, of that individual. And so what they're really concerned with is looking at those expenses that are going to reoccur on a regular monthly basis, like drug expenses or or the premiums on their health insurance. And so when they first apply to the VA, the hearing aid or dental surgery cannot be claimed for an unreimbursed medical expense. But in the future, if that occurs while you're within and covered by the VA pension, then you can submit those expenses in a future year and ensure that your benefits are maintained or increased because of them. Hope that makes sense. It's the difference between a reoccurring medical expense and one that is a one-time medical expense. And so, not when you first apply. You can't use the hearing aid.
Great, thanks. I think even I understood that. So thanks for that answer.
Okay.
It's pretty complicated stuff. We have another caller who does not actually qualify for Medicaid. So what they did is they checked the state's benefit checker. They went online, they checked that, but it said that they didn't qualify because I guess they had too much income. Are there other programs that they can turn to for help?
Yeah, I'm really glad that they submitted that question, because that's often one we often hear about as well when we're talking to clients. And that is, they come to us, they're really concerned, they've learned through a website that they're not eligible for Medicaid and they don't know what to do. First of all, it's just a website. Get a second opinion, because as we tried to stress during the talk, the eligibility requirements for Medicaid are really complicated, and if you don't at first aren't allowed to get this benefit, then you may become eligible in the future. But let's not stop there. They're really you should call the area agency on aging or a benefits advisor or an attorney or anyone who may have gone through the Medicaid process before and can be a little bit more of an advisor for you. And also, these tools are great because they give quick answers, but just keep in mind that these tools can be a risk for giving you false negative. That's you get turned down even though you shouldn't have been turned down on them. So I've used several of them in different states, and I've been disappointed with the results, not for myself, but for some of our clients.
Great, thanks a lot. I think these days with everyone's doing online banking and websites, and we're also comfortable with these online tools. We almost think that they're almost infallible. So when we get something that says, well, you can't qualify, you think, well, the website said it, so the website's probably right. So that's actually fantastic advice to follow up on that. And it's a bit of an additional add-on to that question. So these advisors you mentioned, either elder law attorneys or benefits advisors, do you have any advice on how to find a trusted professional, one who's going to have your best interest at heart and one who's very a qualified professional?
Well, within your network here at Family Caregiver Alliance, I think that you guys provide a great resource for helping to identify the reputable professionals in the area and throughout the country for your members. I'm not 100% sure of that, but that's one place to turn to is local nonprofit organizations or other organizations that might be specialize in looking at caregiver assistance programs or others. We, as I said earlier, we run a separate brand, an organization called Elder Care Resource Planning. So this is a direct, customized planning service for families. So when the situation is particularly complex or difficult, to make sure to put together a plan that ensures that the elder can afford the care that they need, and minimizes the cost out of pocket for the family. That's what we specialize in when we work with those families on the elder care resource planning side of our business.
Perfect, thank you. Let's see, we've got an interesting question here. So the listener, their parents are married. They are starting to run out of money for their assisted living. However, the father was actually a veteran from World War II. And so they wanted to know, you mentioned that there are actually different kinds of benefits. So they're wondering if the VA pension or maybe a state Medicaid program would make more sense in terms of the highest quality and highest level of benefits for them.
Yeah, that's always a tricky one, and it's one we often address is, should we do Medicaid or should we look at the VA pension benefits first, or which one will pay better? When it comes to assisted living, for a variety of historical reasons, Medicaid can be a bit of a challenge for paying for the living costs associated with assisted living. It's assisted living, so there's both care and also living costs associated with room and board, food, the rent, keeping the lights on, etc. And when Medicaid pays out for these programs, in general, they're restricted by federal law to only pay for the care that the individual receives in the assisted living community. So that may mean that the Medicaid benefit for the married couple living in assisted living will be limited for them. It may not be very much. Instead of that, you might consider the VA pension, which is also limited but not restricted to living expenses. So if an elderly couple needs assisted living, one is a wartime veteran, then they'll be eligible for up to $2,178, 2,100 and change, let's say, and they can apply all 2,100 monthly income towards their assisted living costs. Sometimes that's just the help they needed to make sure assisted living remains affordable for them. And sometimes it isn't. So sometimes it can be combined with the Medicaid as well in that state if the state has assisted living benefits. So you got to check on that. We have an article specifically on that at payingforseniorcare.com under our assisted living section.
Okay, perfect. I think we have time for maybe 2 more questions. I've got a good one here. The question is, if someone's already on Medicaid, would they automatically get the Medicare premium assistance, or would they have to specifically, reapply for that?
Excellent question. If they're already on Medicaid, then they and the Medicaid staff had evaluated them for their Medicare premium assistance, then yes. And generally, because the Medicaid restrictions or requirements are similar, but not the same as the Medicare premium or savings programs where they help you pay for your premiums, because they're similar, there's a tendency there to generally approve the individual for both at the same time. That is not an automatic. You should always check to make sure if the individual is very low income, then they should not have to pay. As under $1,200 and very low savings, then there should not be any Medicare Part B premium of $104 deducted from their Social Security check.
Perfect, thank you. So let us see. Okay, I think for our second to last question, we have a listener whose parents are actually doing fine. Always good news, but they are worried about the future when they might not be able to support each other, the parents. So the listener wants to know what they could do right now to actually start planning for that possibility.
Okay. So the parents are healthy and they have maybe some resources and or equity in a home. Well, this is a great time to begin to think ahead. One thing we always recommend that all families consider is to make sure that they have their wills written. If there's any special materials or property that they want to provide to certain individuals or in certain ways, for instance, a gift to the Family Caregiver Alliance, they can do that through a will and ahead of time. And of course, along with the will is something called the living will, now known by its rather more bureaucratic name called the Advanced Directive for Healthcare. There's state-specific templates available from the AARP at aarp.org to find a state-specific living will or advanced directive. Everyone should always do that. Even we did it in our family just this Christmas. Everybody in the family did it as a kind of a gift to each other, because you never know what can happen, and it's always good to appoint somebody else as a proxy.
Right, thank you. People sometimes maybe feel very, or not very, but can feel, uncomfortable about talking about these issues. But once it's too late, it's really too late. And the time to get it done is really when people are of sound mind and body. So yeah, it's so important to get these things done. And it's a big comfort, actually, it seems.
Yeah, not just for the individual, but for the family around them, who might become their caregivers if they're not able to speak for themselves. So it's more for everyone else around you.
Yeah. For our last question, this is actually something I was wondering about. It was about the VA pension program. I had heard that a spouse can't get paid for their caregiving, say if they're taking care of the other spouse, like other family members might. I was wondering if this is actually true, and if so, if you could explain maybe a little bit more about that. Okay,
yeah, great question, great clarification. That is one of the exceptions to becoming a paid caregiver and having that payment qualify as an unreimbursed medical expense for a veteran's senior pension. And so the spouse is considered, their income is considered together with the veteran's income when the veteran applies for benefits. So if the veteran pays the spouse for the services that they do, then of course they're still going to have the same amount of income or more, and that will not necessarily work in terms of qualifying that individual. So in general, the VA just has created a prohibition of allowing the spouse to be a paid caregiver. But adult children or other friends of the family could become a paid caregiver and would qualify with a caregiver agreement for a VA pension through that mechanism.
Okay, perfect. Thank you so much. I think that's all the time we have now for questions. If you do have any additional questions that weren't covered, you can feel free to email us at Family Caregiver Alliance. Otherwise, Michael, would you mind giving your information out again just for listeners if they'd like to get in contact or if they had some questions for you?
Sure. I'm going to rocket through the slides. I'm going to rocket through the slides and end up on the wrong slide. And it's Miguel, Miguel, at payingforseniorcare.com, and the phone there is 415-513-0303. That's for my direct line, and our general inbox and general voicemail are above in the info at and the 641 number.
Okay, perfect. Well, thanks so much. I'd like to thank everyone for participating in our webinar presented by Michael Guerrero. Thank you, Michael, again for being with us today.
It's my pleasure. Glad to have you here. Glad to meet everyone here at Family Caregiver Alliance in person.
Please join us on October 6th for Hiring a Home Care Provider, a Guide for Family Caregivers. That's going to be with Jessica Lehman. You can visit our website, caregiver.org, for more information about that. The webinar is now concluded, and we hope to see you all next month. Have a great afternoon.